Hello, my name is Sophie Clifton and I go to Bullard High School and I will be competing in the clinical specialty event at HOSA this year. Today I will be demonstrating and showing how to perform an endoscopic lumbar dissectomy. Off this procedure, I'll be showing a close-up of the spinal cord so that a better look can be taken at what is going on in the procedure. To start, I've already washed my hands and my scrub nurse has scrubbed me in, so she will proceed to hand me a scalpel so that I may make an incision about 1 millimeter thick and 2 to 3 inches long. Here is a close-up view of the incision that I had made into the spine between the L3 and L4 lumbar. I widen this incision with a small wire that is inserted so that the hole can be made bigger and so that the 2 tubes that go over the wire can go over a lot smoother and into the skin, into the back. My scrub nurse is then going to hand me 2 tubes. Sometimes there will be 3, indicating a larger hole needed depending on the size of the patient or size of the disc that is herniated. So here again, I'm just checking the positioning of the tube to make sure that it is in the correct spot. And then I will proceed to use a pair of forceps or large tweezers to remove the wire and the first tube that was placed over, so that there is just one remaining tube that is the largest so that I can see into my incision and where I will be operating. After I remove both of the tubes, I will then take an x-ray to check the positioning. And again, here's a close-up of what I just did, placing the wire and then the tube, and then the larger tube over the second one, and then pulling the wire and the first tube out so that the view into the incision can be seen clearly through the microscope. So here's where the procedure starts. I will use a cauterizing tool to remove any tissue and fat that may be in the way. And after I cauterize, I will use some type of bone drill to get rid of excess bone and vertebrae that will eventually grow back after the procedure is over. After cleaning out and a way through to the nerve root where the herniated disc is bulging underneath, I use small tools and angled forceps to get any of the herniated disc out from underneath the nerve root so that pain can be alleviated. There will be a sort of back and forth manner with taking x-rays and scraping out excess herniated disc pieces. So for the intents of being able to see what I'm doing a little bit better, I did take the tube out, but typically it will stay in for the procedure. And again, I just scrape underneath the nerve root, and typically another nurse or surgeon is holding back the rest of the nerves and veins that are in the spine so that nothing accidentally gets nicked or bleeding out or anything like that happens. After the final x-ray has been taken and confirmation of all herniated disc pieces have been removed, the surgeon is finally ready to take out the tubing that has been holding the incision open. So using a couple of tools, they will remove the tube and sterilize it to be used again. Several gauze or cotton pieces and a foam to stop bleeding is put into the incision. The surgeon's job is pretty well over at this point. He will be scrubbed out, and the nurse practitioner or other surgeon assisting will close up the patient and be sent to recovery. Here again is another close-up of what I was doing. That concludes how to perform an endoscopic lumbar disectomy. I hope this video was helpful in learning how to perform this type of procedure. Thank you.